Excessive salt consumption is a common dietary habit that can have detrimental effects on health, contributing to various health problems and increasing the risk of chronic diseases. While salt, sodium chloride, is an essential mineral necessary for bodily functions, consuming too much salt can lead to numerous adverse health effects. In this video, we'll explore 10 dangers of consuming too much salt and how it can negatively impact your health. Before delving into the dangers, it's important to understand the role of salt in the body and recommended intake levels. Salt plays a vital role in maintaining fluid balance, nerve function, and muscle contraction. However, the average salt intake in many Western diets far exceeds the recommended levels, leading to health complications. One of the most well-known dangers of excessive salt consumption is its association with high blood pressure, hypertension. Salt retains water in the body, increasing blood volume and putting pressure on blood vessel walls. Over time, this can lead to hypertension, a major risk factor for heart disease, stroke, and kidney damage. High salt intake is strongly linked to an increased risk of heart disease and cardiovascular events, such as heart attacks and strokes. Excess salt consumption can raise blood pressure, strain the heart, and contribute to the development of atherosclerosis, hardening of the arteries, narrowing blood vessels, and reducing blood flow to the heart and brain. Consuming too much salt can significantly increase the risk of stroke, a life-threatening medical emergency characterized by the sudden interruption of blood flow to the brain. High blood pressure, caused by excess salt intake, damages blood vessels and increases the likelihood of blood clots forming, leading to ischemic strokes. The kidneys play a crucial role in regulating sodium levels in the body. Excessive salt consumption can strain the kidneys, leading to reduced kidney function, fluid retention, and electrolyte imbalances. Over time, this can contribute to kidney damage, kidney stones, and chronic kidney disease. High salt intake can increase calcium excretion in the urine, leading to calcium depletion in the bones and an increased risk of osteoporosis, a condition characterized by weak, brittle bones prone to fractures. Excess salt consumption may accelerate bone loss and decrease bone density, particularly in older adults. Studies have suggested that a high-salt diet may increase the risk of stomach cancer, particularly in individuals with a genetic predisposition to the disease. Excessive salt intake can damage the stomach lining, leading to inflammation, ulcers, and an increased risk of gastric cancer over time. Salt attracts water and promotes fluid retention in the body, leading to bloating, swelling, and edema, fluid buildup in the extremities, abdomen, and other tissues. Chronic fluid retention can strain the heart, kidneys, and circulatory system, exacerbating existing health conditions and impairing overall well-being. Some research suggests that high salt intake may be associated with an increased risk of cognitive decline and dementia in older adults. Excessive salt consumption can contribute to hypertension, stroke, and vascular damage, all of which are risk factors for cognitive impairment and Alzheimer's disease. Consuming too much salt can lead to increased thirst as the body attempts to dilute excess sodium in the bloodstream. Chronic thirst may lead to excessive fluid intake, further exacerbating fluid retention, electrolyte imbalances, and strain on the kidneys and cardiovascular system. High salt intake during pregnancy may increase the risk of adverse outcomes such as preeclampsia, gestational hypertension, and fetal growth restriction. Excess salt consumption can lead to fluid retention, elevated blood pressure, and impaired placental function, potentially compromising maternal and fetal health. While salt is an essential nutrient, consuming too much salt can have serious health consequences, ranging from high blood pressure and heart disease to kidney damage and cognitive decline. By monitoring salt intake, opting for low-sodium food choices, and adopting a balanced diet rich in fruits, vegetables, and whole grains, individuals can reduce their risk of salt-related health problems and promote overall well-being.